The broadcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to a new approach to assessing family engagement in healthcare systems. I'm Bev Johnson, President and Chief Executive Officer of the Institute for Patient and Family-Centered Care. I will be moderating today's discussion. We are recording this webinar, and it will be available on the Lucile Packard Foundation for Children's Health website in the coming weeks. This webinar takes a deeper look at a recent issue brief that I hope all of you have read from Family Voices National Office entitled A Framework for Assessing Family Engagement in Systems Change. Today, we really want to try and bring the concepts from this framework to life, from the development of the framework into a tool for meaningful family engagement, to how a parent-led organization and a state agency are using the framework to examine their family engagement efforts and inform future systems-level initiatives. Joining me today are three wonderful experts from the field. Beth Doretsky, a project manager at Family Voices, Nancy Lubago, co-executive director of PATH, Parent to Parent Family Voices of Connecticut, and Susan Chacon, president of AMCHIP and the Title V director for Children's Medical Services, Children and Youth with Special Healthcare Needs program in New Mexico. We want this to be really an engaging conversation with all of you out there in the field and with our wonderful speakers today. And we encourage you to submit questions in the GoToWebinar question box. We will try to get to as many as we can today. So please be thinking about those questions that you want to pitch our terrific presenters. Our first presenter, Beth Doretsky, is the team lead for the Family Engagement and Systems Assessment Tool and Toolkit project. She brings a wonderful depth of experience in family leadership, formerly serving as project director for the Massachusetts Family to Family Health Information Center. Beth will provide an overview of the Family Voices framework for assessing family engagement. Beth?
Thank you for that introduction, Bev, and thanks to everyone for joining. I'm pleased to have this opportunity to share information about the framework for assessing family engagement and systems change that Family Voices created with support from the Lucile Packard Foundation for Children's Health. So, why do we need a new approach to assessing family engagement at the systems level? And by that we mean in policy, program, practices, and services and other initiatives that organizations undertake to improve child and family serving systems of care and health outcomes. Increasingly, state agencies, health insurers, hospitals, researchers, and other organizations that serve children and families are expected or even required to engage families in activities beyond the individual family provider level, are often limited to asking them to react to policies, programs, practices, and services that were created without their input. And these efforts are often assessed with process measures, for example, the numbers of families and youth who attend a meeting or who participated on a family advisory council. So systems level engagement means including families from the start in the development, implementation, and evaluation of policies, programs, practices, and services. And family engagement at the systems level recognizes the importance of nothing about us without us, the rallying cry of the disability movement in the 1990s. It's as meaningful today as it was almost 2 decades ago, as creating or amending systems level initiatives must include full and direct participation of the members of the group affected, as without the critical input of the individuals and their families in that process, there can be unintended consequences that often create barriers when the intention was the opposite, which was to improve a system of care. So as an example, many states have created autism mandates so that certain private health insurers have to cover autism services, specifically applied behavioral analysis. However, the way the mandates were written did not take the implementation of those mandates into account. If families who had experience with and knowledge of the difficulties of getting health insurance coverage for autism services had been engaged in the process, they could have pointed out the unintended consequences of mandates that require a child to have a diagnosis of autism in order to receive the services, and of the requirements for ABA providers to have certain levels of credentialing in order for the insurance to cover the cost of ABA. This has resulted in barriers in access to care. There are long waiting lists for limited numbers of providers who can make the diagnosis of autism, and for the shortage of providers with the level of board certification the mandate specifies. So therefore, a framework that organizations can use to support meaningful family engagement and systems initiatives, it's very timely for this framework, as there's a continuous need for families to be engaged in the systems that support the health and well-being of their children and families. I also wanted to make it to be clear that the framework is not limited to children and youth with special health care needs. As you'll see on this slide, nothing about us without us is important to more groups than just individuals with disabilities, and includes those who are LGBTQ, the elderly, and also there are systems of care that recognize the importance of nothing about us without us, as it's included in the 6 pillars of learning for the fundamentals of nursing and in the 12-point framework for innovations in mental health. Next slide, please. This is the definition that we used in the framework, for, the definition of family engagement that we used in the framework, with a slight adjustment to recognize that family engagement can mean partnership between organizations and family-led or community-based organizations. For example, a Medicaid program might collaborate with a family-to-family health information center to share data, identify a systemic problem and access to care, and work together on a systems level initiative to address the issue. It also recognizes that organizations, staff, and family leaders can collaborate on a systems level initiative, such as writing a grant to fund respite services. Next slide, please. As noted in the framework, we identified 4 domains of family engagement. I'm presenting the domains in a different order than they appear in the framework, and some of the key criteria are different as well. Since the framework was published last April, we've done cognitive testing, and based on what we learned, we've reordered the domains and refined many of the key criteria. So I don't want to take a lot of time reviewing the key criteria in each domain that support family engagement, as Nancy and Susan are going to provide specific examples, but I did want to just make a couple of, to distinguish one thing here in the commitment domain. In that support, when we say support, it refers to the peer support, mentoring, and leadership skill building opportunities that both family leaders and organization staff might need to understand their partnership roles. Compensation is different kind of support, because it's important to recognize the costs in both time and real expenses that families can incur just because they're taking the time to participate. So this might include things like childcare and travel, as well as compensating families. Next slide, please. This is the transparency domain, and these are some of the key criteria that support transparency. But basically, transparency means giving families the information and the materials that they need in a timely manner to ensure that they can participate to the maximum extent possible. Next slide, please. Representation. Representation occurs when family leaders reflect the diversity of the community served by the organization. And specifically, if an organization doesn't have its own internal mechanism for recruiting family members who are representative of the race, ethnicity, culture, language, age, gender, disability, and geographic areas served by their organization. It can be helpful. It can be helpful to partner with a family-led or community-based organization, such as a family-to-family health information center or a community-based organization such as a cultural broker, because these organizations have developed relationships with diverse and medically served underserved families throughout their states, and they have connections and existing relationships to reach out and identify and recruit families that may be willing to partner in whatever the systems level activity that the organization is undertaking. Next slide, please. So the impact domain describes areas where family leaders were incorporated at the systems level to improve policies, programs, services, and practice. And it would mean that family leaders or organization partners work together in choosing the goals, in implementation, evaluation, and that what the families say actually has actually influenced the programmatic the options that the organization has chosen. And we also realize that engagement occurs over time. Next slide, please. That impact occurs over time. So the framework can be used as a checklist to help organizations plan efforts to engage families in system-level initiatives. And it is all internally at Family Voices. We have also used that framework to inform the development of a family engagement and systems assessment tool, so that organizations can assess how well it engages families and youth in policies, programs, practices, and services. They can use it to guide the design of systems level activities to ensure family and youth engagement. And they can also use the family engagement and systems assessment tool as for quality improvement. They can use it over time to assess efforts towards meaningful family and youth engagement. It can also be scored to provide an overall score as well as individual scores for each domain. And we're currently developing a toolkit as a companion to the assessment tool that will have resources and strategies for improving family engagement Next slide, please. So feel free to follow up with me if you have any questions or you want some more information. And I'm going to turn it back to Bev. Thank you.
Thank you so much, Beth. That was a terrific overview of the Family Engagement and Systems Assessment tool. Thank you so much. Now, I'm pleased to welcome Namfi Lubogo. Namfi is the wife and mother of 3 children. Her daughter, Stephanie, was diagnosed with multiple special needs. As a family leader, Namfi has focused on parent-to-parent support with a particular interest in cultural competency, emergency medical services for children and youth with special healthcare needs, and parent leadership training and development. Namfi will share the parent perspective and describe how she helps to engage healthcare agencies and organizations within the context of the 4 domains that Beth just described to you in the Family Engagement Assessment tool. Namfi?
Hi, thank you. Thank you, Bev. So yes, I'm going to talk to you today about our family engagement project, which for us was a partnership between our organization and the New England Regional Genetics Network. Next slide, please. So our partnership began actually 10 years with the New England Genetics Network when it was still the NEGC, which was the New England Genetics Collaborative. And our partnership began when we began applying for grants through them unsuccessfully, but we developed a relationship. And then when the NEGC became NERGEN, and they were digging into family engagement through genetic services as part of their quality improvement project, they gave us a call and asked us if we wanted to participate, and they were able to write us into their grant that they wrote to Maternal and Child Health and HRSA. And so I'm going to be talking to you about family engagement through the 4 domains that Bev had mentioned. Next slide, please. So as I mentioned, it was a partnership, and it was a partnership with all across the 6 New England states, Maine, Vermont, New Hampshire, Massachusetts, Rhode Island, and Connecticut. And our project, particularly, each state focused on family engagement as it best suited their state. And in our state, in the state of Connecticut, we decided to take that approach by reaching out through the hospital population, just to ensure that we got representation from diverse and medically underserved families, because that was one of their NERGEN's biggest criteria. They're trying to reach to underserved families. So we reached our families through the neonatal intensive care units, through for kids who had just been born and either diagnosed or awaiting diagnoses, and those that left the NICUs and had gotten the birth to three referrals. We tried to reach those families too. And then families who were kind of in that gray area where they had gotten a diagnosis and were waiting to have another appointment with a genetics specialist and needed some more information on a diagnosis. They needed more understanding of what the diagnosis was. They needed resources to help them make sure that they, number one, knew where to go to make their appointment. They had resources to understand what the genetic condition was. So those are the families that we targeted as part of our criteria, and some of the other states in New England, had different focuses. And so we were able to get through a small budget through NERGEN. I mentioned the New England Genetics Regional Network is called NERGEN, so you'll hear me say that. And we had a small budget to hire one of our staff to focus particularly on genetics work. And they did a Genetics 101 training for us. They provided resources and basically did a lot of technical assistance. So any diagnosis that we came across through a family in the NICU or through a birth to three referral or outside, we're able to give the families information. We're able to go with them on either go onto the website, research the information for them, and provide it to them in that way. And like I mentioned, we got a small pocket of compensation for that. Next slide, please. And this is so talking about the transparency domain that Bev had mentioned. We went about creating shared language. This was making sure that our website, the genetics website, NERGEN's genetic website that has a lot of great information, was readable to families, that they could go on there and understand the information that they're looking at. The website has 37 different genetic conditions, and most of it is available through the GEMS for Schools website, which is through the NERGEN website. And it's got some really great, easy, one-pager information on all those 37 conditions. So we're able to give those to any teachers that we come into contact with. Families can share them with either different health providers who are not so familiar with a genetic condition. They can share them with their schools, the school nurses and stuff like that. So we kind of were the go-between for families so that, they were not overwhelmed with a lot of information. So we also reviewed the website and made sure that it was easy and accessible and user-friendly. Next slide, please. So through the impact domain, it focuses on improving access. And like I mentioned, there's a lot of genetic conditions. A lot of times when you're a new family that has just received a genetic diagnosis, you're completely overwhelmed, and I can speak to that myself as a family member. So we really understand what families are, the difficulties that they have to accessing some of the information. And so like I said, we would get the info, would print it out, the simple one-pagers, provide it to them, and then ask them, help them to prepare if they had any questions for the health provider or the specialist, that we could help them to understand that, jot some simple questions down to ask the provider. And so that's something that we worked on with NERGEN. Their staff was available to kind of give us the technical assistance, answer any questions that we had, go over any of the materials that were available on the website through a series of follow-up calls and genetic webinars. We did a couple of satisfaction surveys. Anything that was would be provided to families, we had a chance to review first and make sure that those things made sense before they went out. Next slide, please. So speaking about commitment, the New England Genetics Regional Network made a commitment to improve on family engagement. They've made a long-term investment. So like I said, 10 years in the making our relationship was. And I think this is really key for those of you who run agencies to remember family engagement takes time. And in order to make an investment in it, you have to make a commitment. You have to be dedicated to it. You have to keep trying. It's not always easy. And you, like Bev had mentioned in her presentation, you have to work with the cultural brokers. So, you know, NERGEN was utilizing our organization as a family-to-family, as the family voices, and as a parent-to-parent, kind of as a cultural broker, or in between us, in between families and health providers, kind of bridging the gap between the two. Next slide, please. And I just wanted to end with this before I talk about this, I just wanted to talk about some of the challenges that we faced. You know, one of it obviously is funding. Funding is always an issue when you're dealing with a parent organization, and so it was nice to have a little pocket of money to be able to do this project. I mean, as a family voices and parent-to-parent, we're all a community-based organization. We do this work all the time, and so it's nice when organizations make that commitment and actually put the money behind. So that was one of the successes to the challenges that we had in trying to reach these families. Obviously, you know, I think Bev talked about this. Beth talked about this in her presentation, working with cultural brokers. Working with special populations is always a challenge because there's a trust factor. And we face that with some of the populations that we're trying to reach, the Native American population and the Southeast Asian population, Southeast Asian American community in our state. And we're working to address some of these challenges, but it would have been very difficult for you know, an outside agency like NERGEN to come in and try to work with this organization if they didn't have us kind of as a go-between. So we're working to address some of those challenges and just, you know, to get the material in different languages, make sure that, as I said before, the material is accessible and understandable to families. And so just to close, I like this saying regarding family engagement. It's a family wisdom kind of part of family engagement. It seems obvious, but it's not always. And it says, we join others even as we ask others to join us. I really like this saying because it means that your family engagement is about transformation. It's about, you know, putting on a different shift on how agencies are used to doing their work. And this just kind of shows kind of like the circle continuum of care. We join others even as we ask others to join us. So thank you.
Thank you, Namphy, for a wonderful presentation, and I hope you will all follow up with her. Here's her contact information. And I love your thought of family wisdom and the mutuality of the work that you all do. We've always designed and always interpreted the kind of collaboration and partnerships that we're all working towards as mutually beneficial partnerships. So thank you for sharing with us today. And now we are fortunate to hear from Susan Chacon. In her Title V director role, Susan works to assure a statewide system of coordinated, compassionate, family-centered, and culturally competent care for children who have chronic medical conditions and/or disabilities. She also focuses on ensuring access to a range of primary care and specialty service. Susan will share with us now how New Mexico has engaged families in Title V's work. Susan?
Thank you, Bev, and thanks, Beth and Nan, for your presentation. And I'm going to talk to you today about how the New Mexico Title V program incorporated family input into the Title V needs assessment. Title V is the federal maternal and child health block grant that every state and territory receives. It is a federal-state partnership whose goal is to improve the service system for the maternal child health population. A comprehensive needs assessment is required every 5 years. Next slide, please. A few facts about New Mexico. We're a minority-majority state, so most of our population is non-white. We have very high poverty rates, especially for children. Our southern border borders Mexico, so in the southern regions, our maternal child health issues are binational, and there is a large, diverse Native American population with 19 pueblos and 3 reservations. We're also a typical Western state that has rural and frontier areas. Next slide, please. As we began our Title V needs assessment, we were very cognizant of the fact that we needed to reflect the diversity of our population. So to start, we convened a panel of experts working in the field of children and youth with special health care needs. And these experts included our community-based family-led organizations such as Family Voices, Parents Reaching Out, which is home to our family-to-family health information system, and EPICS, the education of parents of Indian children with special needs, who work closely with Native American families. The panel reviewed various data sets and priority areas were identified. And some of those data sets were the National Survey of Children Health, IDEA Part B and C, Medicaid data, and some New Mexico specific data sets. After the process was completed, a post-evaluation was done, and all members indicated to us that they were involved in the decision-making process and that the decisions accurately reflected the consensus of the group. Next slide, please. Our program was pleased with the initial process, but we still felt we needed more input from families and wanted to hear from families in our rural areas and to better reflect our diversity. So we developed a survey based on the priorities selected by our expert panel. It was in English and Spanish. We felt we needed to go to places that families were convening to collect additional input. Again, we relied on our community-based family organizations to assist us with this process. Next slide, please. We brought our surveys to several locations. We went to our Children's Medical Services pediatric specialty outreach clinics, which are located in rural communities across our state. We attended the family leadership conferences hosted by Parents Reaching Out and EPICS, Education of Parents of Indian Children with Special Needs, and the survey was posted on the Family to Family Health Information Center listserv. We had an overwhelming response. Next slide, please. But the results were not what we expected. And of the families we surveyed, child abuse and neglect and behavioral health rose to the top. This kind of put us in a quandary because as a Title V program, really our purview is around healthcare and healthcare access. So we weren't sure. We did a lot of thinking about how we were going to address this and incorporate what we had heard directly from families. So because the scoring was so high, we felt that we could not ignore it, and we were compelled to include these issues in our needs assessment and state action plan. We decided to create a separate state performance measure for child abuse and neglect and to make behavioral health a cross-cutting issue across all our domains. Next slide, please. To truly understand the maternal child health needs in your state, engaging diverse family leaders in the Title V block grant is essential. And this is a list of some of the community-based family-led organizations that we work with. And again, that's EPICS, works closely with Native American families. Hands and Voices works with families that have a child that's deaf and hard of hearing. Our Asian Family Center, Tribal Home Visiting Programs, Family Voices, Parents Reaching Out, and the Navajo Family Resource Center. So how do we show our commitment to our family and community-based organizations? We use Title V funding to support leadership conferences and professional development of staff. Both Parents Reaching Out and EPICS have an annual leadership training, and Title V supports scholarships for families to attend. We also provide funding to these community-based organizations, so there is family representation at national meetings, such as the Early Hearing Detection and Intervention meeting, the Association of Maternal Child Health meeting, Hands and Voices National. There is family representation on our advisory committees for early hearing detection and intervention, newborn genetics screening, and we utilize family input on program policies and publications. We present jointly at conferences, so we try to showcase that family professional partnership. We have family participation in our annual title review process. We provide parent training on Title V services. We have mutual support for projects. We write letters of support if we're submitting grant applications. I can call anyone at any of these organizations if I'm needing help on a project, and vice versa. They can reach out to me, and I'm happy to assist in any projects. We have clear lines of communication, and most importantly, we are valued and trusted partners, and we can depend on each other. Next slide, please. And I want to thank you very much for the opportunity to present.
Thank you, Susan. That was wonderful, and thank you for all the great work that happens in New Mexico for really decades. It's wonderful to see that it is still going on. Really 3 wonderful presentations, all very thoughtful about this important new tool. There have been a number of questions, and I hope you're making notes and chatting in your ideas and thoughts to the space for questions. I'm going to start dealing with some of them. One of the questions was, what's a cultural broker? Either any of you want to answer that question?
Yeah, sure. This is Nancy LaBoca. I would be happy to answer that. So a cultural broker, I can't exactly remember what the technical term is in cultural competence training, but in essence, it means a trusted person who is a member of a particular community or a particular group that can assist an outside agency or outside people, person to connect with the community that you're trying to engage with. That can assist you because that person is trusted, so you can utilize that person to reach out to and work with that organization. It's extremely critical. I mean, you would hit roadblocks and hit all the gatekeepers if you did not try to utilize this person. And how, one of the questions is, how would you go about finding them? You have to learn a lot about the organization. You can talk to people, any parents or any agencies that work in the area, and ask who would be that cultural broker. It doesn't necessarily have to be a person. It could also be like an organization. It could be a community-based organization that's in that community. I don't know, Beth and Susan, if you wanted to add anything to that.
Hi, this is Susan. I could add to that. So an example is in New Mexico, we have many different tribes, and we use the family-led organizations, specifically EPICS. They work specifically with the different tribes and the Native American families. We've worked with them for several years to help us get the message out around newborn hearing screening and the importance of follow-up on hearing screening and kind of developmental screening, watching milestones. And they help us because we probably wouldn't be able to go into a Pueblo and do presentations like that, but that's their work. So we partner with them and we provide funding so that they can help us get information out to tribal families.
That's terrific. There were other questions, I think, relating back to the assessment tool in terms of health literacy and cultural competence. Are Beth or any of the other presenters want to comment on how you're going about finding out about these issues and exploring the issues in more depth with the family engagement work?
So this is Beth, and I would just ask for some clarification. Cultural competence and health literacy of the actual tool, or as a key criteria?
I think that I'm not sure that I had a lot of information about it. Perhaps make sure in terms of the tool, and then are you tapping into and learning about the constituency and their health literacy? Do you think the tool is that families will understand the questions you're asking and that it will work for diverse populations that are involved in this collaborative work?
So yes, and I'm going to respond yes, because we did a fair amount of cognitive testing of the items in the Family Engagement and Systems Assessment tool and got a lot of feedback about terms that we should change or clarify, how we worded things, and we did test the tool with families and with organization staff from a variety of organizations to ensure the cultural competence and health literacy of the tool. We're also getting ready to pilot the tool, and so if there are any remaining issues that we did not address, we hope that they will be identified in the pilot.
That's terrific. Thank you. Really thoughtful work at every stage of the development of the tool. Thank you. Now, V, if you thought about the work that you've been doing, is there, one or two lessons learned that really a pearl that you would like to share with the webinar audience today that was critical to the success of the collaboration across New England?
I think in terms of our particular partnership with NERGEN, I think, it takes time. Family engagement takes time. And, it's hard for agencies to immediately develop a relationship with family organizations and vice versa. Like I mentioned, our relationship started 10 years ago, and we didn't necessarily get any grant funding. We were not successful in any of the grants that we did, but we learned that we had to develop a relationship. So I think that's the key that I would say, is that you have to build a relationship. You have to learn to work with, your cultural brokers. If you're a family organization looking to work with an agency, I think just, don't give up. Keep beating down the door, knocking on the door, just like we were persistent. In terms of we kept on applying and we developed a relationship. We went to the conferences that they had. We responded to surveys. We, we always had our hand up saying, we're here, work with us. And if you're an agency on the other side, I think, like we had mentioned, is learning the population that you're trying to reach out to and trying to establish a relationship with them, learning who their cultural brokers are. So that's what I would say.
Oh, wonderful, wonderful pearls. This engagement takes time, and then the persistence on both sides. We've always felt that to build genuine trust, which is key to working together, it does take time. So thank you for that thoughtful answer. I have another question for you, Beth. Folks have been following the evolution of the tool, and is there an updated version of the tool that's publicly available now before you do your pilot test? Is that available to the public, or do they have to wait a little longer?
I'm sorry, you'll have to wait a little longer. We do want to complete. No, it's because we really do want to be thoughtful about what we put out there, and we want to incorporate. The whole point of pilot testing is to see if there are things that, when the tool is actually put to use, rather than just scored, that work and don't work, and we want to address that so that we don't have to keep saying, hold that thought, wait a minute, there's something else that we needed to address.
And Beth, another question came in that, have you chosen all the pilot sites yet, or is that still a work in process?
That is a work in progress. So we have selected some. We have selected some, but if anyone is interested, please do email me, and I'll be happy to set up a time to talk to you about it.
Great, thank you. Here's another question for all of you. Have any of you engaged an advisory council, a PFAC, to drive the work, or have any advisory groups been sparked to form as you engage those patients and families?
This is Susan. I would say yes. We do have several advisory groups informing us on our work for children in use of special health care needs across the state. And again, we lean on our family-led, community-based organizations to help staff that. And, you know, it's invaluable to us to get that info, because as you could see in my presentation, what we thought were the priority issues were really not the priority issues of the families. So we've had to adjust our strategies and our thinking to really try to address needs.
Great, Susan. Thank you for sharing that. For Namfi and Susan, another question has come in about, have you involved youth in any of these collaborative projects? The wisdom now of adolescents and youth.
Thank you, Bev. This is Nancy. Yes, we have. We're fortunate enough that our organization also runs, is one of the chapters of Kids as Self-Advocates, CASA. So we have a Connecticut CASA here, and we have a youth group of ages 13 to 26. So pretty much everything that we do in our organization, we run through the youth and make sure that we incorporate them. If there's anything that has to do with them, we want their voices at the table. And so all our materials, everything goes through this advisory. It's not an advisory group, it's a youth organization. So yes, we do, definitely. And we do that through, you know, monthly meetings, providing materials to them to look at and kind of vet. We incorporate them into all the projects that we have, including this particular one. And as part of their kind of youth engagement project, we'll be launching very soon a series of kind of public service awareness about how youth engage in healthcare. And some of them do talk a lot about how they first got diagnosed with it, you know, if they have a genetic condition, and how it has been to as a young person living with a disability or a particular genetic condition.
Great, Nancy, thank you. Oops.
And I was going to say one thing. This is Susan. I'd say that's something that we do struggle with, to try to get the youth voice. We've had various projects where, again, we've had to reach out to different agencies and organizations that work with youth. But it's an area we can definitely improve on, and it can be a challenge.
Great. Thank you.
Beth, can I just?
Yes.
This is Nancy. Can I just quickly just add one thing? We're talking about family engagement here, but I'm so glad that somebody asked this question, because it is family engagement, but the families of whom? Their children and their youth. So it's really critical for people, for agencies when they're thinking about to involve families of children of all ages, not particularly just younger children. So I'm so glad that question came up. And I can speak to some of the work that we're doing. Connecticut CASA and the National CASA is working on a project soon to be out there to help organizations to consider youth engagement and how you get a youth engagement project or organization going. So you guys can stay tuned to that.
I think that's particularly important work, that you're helping youth gain experience and expertise in being partners for improvement and helping to grow the next generation of individual and family leaders for this work. So thank you for that. Here's an interesting question. I'm going to read it carefully, and Susan, you may want to respond, but others may want to respond as well. Our health system serves a population of patients that come from a wide area, rural and poor. Over 65% of our patients are on Medicaid. Our senior leaders say they cannot compensate or pay expenses to families and patients because of a CMS ruling that says they cannot be seen to, quote, the question says, incentivize patients. This is an age-old issue, and I just wonder, are we ever going to be able to get past it?
That's an excellent question, and I can relate to that, working for a state agency. So I think I have two thoughts. One, kind of like, if you build it, they will come. So if there's a way to go out to communities and invite families to a forum or a town hall, people will come, because and what I've experienced is that families have a lot to say and they want to be heard. So if you go to a community and offer that, people will might have people come and talk to you. And the other idea I have is to reach out to like the family voices in your state. Every state does have a family-to-family health information center, which that's their expertise is around healthcare, and talk to them and maybe brainstorm on how you could achieve that, because I think they would probably have some ideas, and they do represent the voice of families across the state. So I would recommend reaching out to Family Voices to see who your affiliate is in your state.
Nancy or Beth, any further comments on this question?
Sure, this is Nancy. I think, we have to kind of, we have to have a paradigm shift in how we consider family engagement and, quote unquote, incentivizing. I think, if you really truly want family engagement, there's, like, Susan said, there's so many different ways and creative ways of going about that. But I think, you bring families to the table, maybe you can give them a stipend. You're not paying them to get involved. You're really providing a stipend so that they can come and participate. Maybe they're going to use that stipend for childcare or, for mileage, gas mileage, or, stuff like that. Maybe you provide a meal or something. There's so many different and creative ways that you can do that. But, like she said, contact the family voices in your state. There's a parent-to-parent also in your state, or family-to-family. And some of them, like ours, play all three roles, and some of them are different. But I think we really have to shift away from how we have thought, we used to think about family engagement, and really just think about, this should be the thread throughout your whole program. And I think when you really, make a commitment to it, and you incorporate it by, like I said, stipends or however, or maybe giving a small grant to that organization so that they can give the support to the families, that would be the way to do it.
So this is Beth, and I just wanted to echo what Namfi had said, because many Title V programs do partner with the Family to Family Health Information Center in their state, and oftentimes that partnership includes some financial support. So to use either for a particular project or to help recruit families for, let's say, for participating in the upcoming Title V needs assessment or some other activity. But if you, so even if the money is earmarked for something specific, that frees up money from the Maternal and Child Health Bureau's investment in the F2Fs to actually have a line item to support family participation in these types of activities.
We're seeing collaboration live in this webinar today. Thank you for all of you for responding to that important question. Susan, some folks on the webinar today wanted to learn more about the annual meeting that you have in New Mexico for families and champions, and wondering what the content is like in that meeting.
So there's two meetings sponsored, one by Parents Reaching Out and one by EPICS, and they draw sometimes the same families, sometimes different families, but they have a huge response. Usually it's like they have about 400 participants at each conference, and it's families that have children with disabilities, special needs. So it's a wide range of topics around healthcare, education, IEPs, knowing your rights. The motivation, I think, is knowledge is power. So, educating families on what they need to know to advocate for their children, and just a whole wide range of topics. So it's been going on for many years, and it's something that our program financially supports, I think, as I had mentioned, because it's a way for us to reach families across our state in a different way. So we provide money for stipends for families to attend the conferences, and oftentimes we, as I said, we do joint presentations. So it was a great place. It's a great place for us to go and talk face to face with families and get a pulse on what the issues are, because families come from all across the state to these conferences.
Thanks, Susan. I know that was helpful to those on the call today. There's another question, comment about their work, that they have been engaging families for many years and noticing a trend away from family advisory boards and toward family members being part of the team. I'm curious what tools are available to measure engagement in this model. I often find it hard to separate the family contribution from anyone else's, since everyone is seen as an equal part of the team. What we're seeing is a little of both, which is really important. You need the larger advisory board, but you also need them engaged on key committees and work groups. What do the others think on the call, and about tools to measure this kind of engagement, and particularly the contribution of families in this model?
So this is Beth, and I would say that's exactly the kind of engagement that the Family Engagement and Systems Assessment tool was designed to assess. So currently, because we're still in sort of the development pilot testing stage, I can give an example. So for an activity like that, the tool right now is set up. It's set up as 4 domains. It's a paper and pencil format right now, and family members who participated in the initiative would score the tool. They can score it individually and then discuss their scores amongst themselves and come to a consensus score. And organization staff who participated in the initiative would also score the tool. They can do it individually or come to a consensus among themselves. And then we encourage the participants to meet jointly, see where their responses to the items were similar, and where there might be some differences, come to a consensus score, and then we have an Excel worksheet that if you that you can plug your numbers into, and it will come up with an individual score for each domain and an overall family engagement score. And it will also generate graphics so that you, in addition to a number, you'll have a visual for the domains where there was a lot of success in engaging families, and there may be one or more domains where there is some room for improvement. And then, so you can use the tool as a one-off just to score a single initiative, and then moving forward, you might take what you've learned and improve it, or you can use the tool as a quality improvement to assess quality improvement over time if it's an ongoing initiative.
Any other comments on that question? We're almost to the end of the webinar. I want to make sure we get as many of the questions answered as possible. One of the questions was, would you be using the tool on a regular basis, Beth, or is there a specified amount of time between when you would repeat it? Any thoughts about that?
I'm going to say that it's difficult for me to answer, but I would hope that it would be something that organizations use on an ongoing basis to assess change in how they engage families over time. But the timeline clearly depends on if it's a time-limited project or if it's an ongoing project. If it's an ongoing project, then they might set their own goals, based on like every 3 months. If it's a one-off, or a time-limited project, then maybe they just score it once. And depending on what those scores were the next time that they start a new initiative, they use, they take into consideration things, domains where they could do better, and either use internal resources or hopefully use the toolkit that's companion to the tool to improve in those domains.
Thank you for that thoughtful answer. I think one of the things we found with similar tools is the tools themselves are educational to all involved about what authentic family engagement is. And sometimes your scores go down because you're more discriminating about your answers. But I think that the tool is going to be a great resource to the field. And I thank each of you today for your thoughtful discussion and responsiveness to all the wonderful people that have been on the webinar. I think that's all the time we have for questions today. Thank you to everyone for joining us. We hope that you found this discussion informative. In March, Family Voices and the Lucille Packard Foundation will be at the MCHIP meeting and the Maternal and Child Health Bureau. They will partner together in a session that introduces the Family Engagement and Systems Assessment tool that we discussed today. This will be at the AmChip annual conference. Please be sure to join the team and meet in person if you're going to be attending that meeting. We will be talking more about this framework throughout the year, so please stay tuned to other webinars by the Lucile Packard Foundation. Thank you again and have a great day.